Time now for CURES, and we're so excited because the Connecticut company is really leading the way in helping you fight aging with supplements and a lifestyle that's really designed specifically for you.
Here in studio with us is Dr. David Brady, Chief Medical Officer for Designs for Health. It's so nice to see you.
Thank you. It's a pleasure to be here.
So you have quite a history. I mean, you've been University of Bridgeport. Tell us.
Yeah, I spent 25 years there.
That's
big
remarkable.
Academic career, and culminating as the Vice President of Health Sciences. So I kind of ran all of the medical, dental, allied health, including training naturopathic medical physicians and clinical nutritionists and many other types of providers.
We've talked about the importance of, number one, most of us need some sort of supplementation for optimal health.
Right.
And we're talking about precision medicine. You actually have spent your career designing, that's Designs for Health, some of these simple tests we can take.
Yes.
That can show like what our DNA is and exactly what we need for our bodies.
Yeah, you know, there's a much greater awareness of people with trying to be well, optimally well, not just not having a disease.
Yeah.
And particularly so after the pandemic, because they saw very easily that the people who went into it more healthy had better outcomes, right? They had a better chance. So I think there's even more of an increased awareness and a desire to want to be as healthy as possible and to live as functionally as they want to into older life. So, you know, we design products to help with that. We really feel like we're part of the wellness revolution and the optimal health revolution that needs to complement our healthcare system. And one of the ways we need to do that is to really precisely figure out what an individual needs.
Okay.
And one of the ways we do that is with some modern advanced testing, which we call omics. So we look at metabolomics, genomics, and microbiomics. So we're looking at many different aspects of someone's unique biochemistry and metabolism to help doctors figure out what is the best thing to give them to move the dial on their health and wellness.
How do I do this? Do I come to you, or is this sold over the counter, or how does all that
No, they're
work?
not direct to consumer. They're really meant by intention for you to work with a healthcare provider who understands these things. We feel that that's the best efficacious use of our products, is to have a healthcare provider involved that can help you, and they can order these for you, just like you would get any other lab test ordered.
And many of the functional medicine doctors we've had on this show, like Dr. Artemis Morris or Dr. Jennifer Stagg, they work with you. So the idea, in fact, I took my son, and then they said, you know, just swab the cheek. They want to know exactly. So you could see Scott's DNA through a cheek swab or maybe a urine sample, and you'd be able to tell, let's say he's working on his cholesterol. You can then optimize what he needs.
Yeah, with these tests, it's almost limitless on the kind of areas you can delve into, and one of the ways the doctor or the healthcare provider might pick which one to do first is a lot based on your medical history, not only your history but your family history.
Okay.
Right, because a lot of what we're about is trying to prevent you getting that chronic disease or that acute disease to begin with, because it's a lot harder to manage it once you have it than to stop you from getting it.
And then once you take the test and determine what you need, then there are supplements for that? Is that how it works?
Yes, but the healthcare provider would make the ultimate determination on what to recommend, but there's algorithms and machine learning and all this modern AI stuff that's working in the background, because these tests generate lots of data, and it's complicated. So we give the physician or the healthcare provider sort of the outputs of what the AI and the algorithms say, and then they make the ultimate determination working with the patient hand in hand.
That's fantastic.
The other thing is quality, right? I mean, Scott's talked about this before, that he has often just gone to a big box store and bought a vitamin that he thought he should buy. That's not what you guys do. The purity, and I mean, I learned from talking with you guys that sometimes what you discard, other companies will buy and make a vitamin out of. So you're taking only the purest stuff.
Yeah, I mean, look, the nutritional supplement industry is pretty much like anything else. Consider cars. There's entry-level cars and there's Ferraris, right? And there's a lot of shades of gray in between. We play in the high-end market. We're making products that are for doctors to help patients in support when they have a condition or a medical disease, if you will, that's being treated primarily through a medication maybe, but they want to have complementary care to it. Or we're doing a lot of products that are aimed at wellness, but we're really designing them with the best ingredients possible, and our quality control is impeccable. We're a nutraceutical grade manufacturer. We're not available over the counter at big box stores or anything like that.
Delve deeper.
Yeah, we're going to delve deeper on the CURES podcast that's coming up. Designs for Health, you can check out their website and find out who you could align with, and we'll get to talk to Dr. Brady a lot more. Thank you so much.
Thank you.
Nice to see you.